Good evening. I'm John Nico, the Executive Director of the Union League Legacy Foundation, and it's my pleasure to welcome you to tonight's Public Affairs program. The Legacy Foundation is the nonprofit charity of the Union League of Philadelphia. Inspired by the United States Constitution and the history, the values, and the spirit of the great Union League of Philadelphia, our mission is to create more informed, better citizen leaders. We do this through a host of programs like tonight's Public Affairs program, but I want to highlight one of them because it's one of my favorites of the year, and that's our scholarship program. And on Wednesday, we will award $336,000 to 11 deserving young future citizen leaders. 8 of them are from our Good Citizenship program, which we've been doing now for 75 years, and 3 of them are able scholars. They are the sons and daughters of Union League employees. My thanks to all of the wonderful, generous benefactors that make these programs possible. Now for tonight's program, it's an amazing thing. I was looking back on May 6th, we had either our second or third virtual program, May 6th, 2020, and it was on COVID-19. And it was something very similar to this in terms of title, The Future of COVID or Life with COVID or something like that. And I don't imagine, most of us, certainly I couldn't have imagined that a year later, we'd have another program that would be the future with COVID-19. Once again, we have assembled a great, knowledgeable group of panelists and a wonderful moderator, our very own Ed Trzanski. So without further ado, I'll give you Ed.
John, thank you so much. And everyone watching, thank you for joining us tonight. Friends, if we were going to look at COVID to try to understand it, how we've come this far, what have we learned, what's going on now, what's likely to happen, I think the first thing you might want to do is make sure that you had someone who had experience as an immunologist. And we've hit the nail on the head with Susan R. Bailey, MD, who for the past 30 years has been an allergist and immunologist. She's from the Fort Worth, Texas area, and in that 30-year career has managed to become a leading expert within the state of Texas, in her community, and she has played a variety of roles with the American Medical Association, the most recent ascending to the presidency of the group in June of 2020. So we've got the immunologist side covered. Then you'd want a futurist. You want somebody who could look at what's happening today and tell us where we were going to go tomorrow. You know, the old Wayne Gretzky, you're not the biggest, the strongest. How can you be the greatest? I didn't go to where the puck is. I was going to where it's going to be. And that is my good friend, colleague, and fellow Union League member, Dr. Steve Klasko, who in addition to being the president of Thomas Jefferson University, is the president and CEO of Jefferson Health, the largest health system in the southeastern Pennsylvania region. But more importantly, Dr. Klasko is internationally known as someone who looks to the future and brings it to the present, regardless of whether he's at the World Economic Forum in Davos or in Silicon Valley with his friend Hemant Taneja. Steve Klasko helps us understand what's coming next. So Dr. Bailey, Dr. Klasko, thanks so much for joining us. And let's get right to it. Dr. Bailey, we'll start with you. What have we learned about COVID and ourselves in the last year? What are the big takeaways?
Well, first of all, I want to thank the Union League and thank you for your kind invitation to join you this evening. It's a great honor, and I'm really, really happy to be here. We have learned so much in the past year. I won't go into all the scientific achievements because, going from, 0 to 80 miles an hour on a vaccine in such a short period of time, I think is one of the greatest scientific achievements humankind has ever accomplished. We have learned a lot of great things. We have learned that public-private, even though we already knew it, we have learned that public-private partnerships work. We have learned the usefulness of telemedicine. Fortunately, lots of good people have been working on developing telemedicine for a long time. So, the pieces were in place when it was time to flip the switch. We learned how nimble the system can be if it wants to be. But we've learned a lot of unfortunate things too. We've learned the importance of crisis communication, of total honesty at all times, of avoiding mixed messaging. And even though this was not under our control, we've learned to not have a pandemic during an election year.
Well, yes, we'll have to do better planning next time. Steve Klasko, in many respects, you were on the front line by virtue of Jefferson and the number of COVID patients taken care of, and what you have to do by way of everyday delivery of care. What, from that perspective, along with looking at the future, what is it that you think we've learned, and what are the takeaways of the last year?
Well, thanks. And it's great to be on with you. I would have preferred the title be Future Without COVID-19, but we'll go with Future with COVID-19. So I would say three things. On the Jefferson experience, we had the largest COVID load in the area, about number 25 in the country. We had one of the lowest employee infectivity rates in the country, less than 1%. And some of it, I think, there just gets down to following your mission. Our mission is we improve lives. Our vision is, our values are do the right thing, put people first, and be bold and think different. And it sort of made it easy. We never got anything other than high quality N95 masks. We never changed our gown policy. So, we have one gown, one case, one person. There was a point in time where gowns went up from 20 cents to almost $12 a gallon. We use 15,000 gallons a day. So we took the hit because we followed our mission. It's very much like the J&J credo. And I think overall, we didn't lay off or furlough folks because that's not putting people first. And obviously that had a financial toll. So I think from that point of view, I feel very proud of our frontline heroes and the team that did what they do. I would change that question a little bit in that I don't think I learned anything about healthcare, American healthcare, that I didn't know before. I think the fact of the matter is we have a broken, fragmented, expensive, and inequitable system. And this just basically threw it in our face, right? So, here's a multiple choice test for you. The number one reason that you got hospitalized or died from COVID in Philadelphia was A, not wearing a mask, B, not social distancing, C, your genetic code, or D, your zip code. Well, it's D, your zip code. The other things matter, but the fact is all the things that Dr. Bailey talked about, like telehealth or online education, weren't available to about 22% of our population. And it wasn't 22% of our population across the area. There were certain zip codes that it was 80%. So literally those folks were for all intents and purposes, virtually homeless. And then I think the third thing we learned is that Bernie Sanders was 100% right about the problem and 100% wrong about the solution. When Senator Sanders says, the problem is we have this sick care system and it's geared toward the insurers or the sick care industry. Gosh, did that ever become true with the misalignment between payers and providers? Providers lost hundreds and hundreds and hundreds of millions, in some cases billions of dollars. Payers had their best year ever, because their whole world is on medical loss ratios. So they went to employers, said, this is what we think it's going to cost you. Turns out that the fact is patients didn't get those things. And again, they didn't do anything wrong. It's just how our system is fragmented. And so I think that he was right about that problem. I think we also showed, as you and Dr. Bailey brought up, that, hey, let's have the federal government, state government, city governments all get together and do healthcare because they'll definitely be coordinated. Clearly isn't the answer, right? And we've seen that with vaccine distributions.
So, Dr. Bailey, Steve talks about a broken, fragmented, inefficient system. Reminds you of the old joke, other than that, Mrs. Lincoln, how did you enjoy the play, right? So from your perspective, looking nationally, in terms of the people with whom you've had greatest contact in the last year, is there a recognition that the system is as dysfunctional as Steve suggests at a baseline? And based upon COVID, is there any chance of seeing some sort of meaningful change?
Yes, I think there is widespread recognition that the system is broken and that the status quo is unacceptable. What we'll argue all day long on is how to fix those fragmented pieces. Okay, what I was going to say just went right out of my head. But I think that we can agree that dealing with pandemics and viruses that don't cross state borders doesn't work in a federalist system. That you can't just leave some things to the states that don't have the expertise and aren't prepared for it. And we learned that not only is our overall health system dysfunctional and broken, our public health system is critically ill. And unfortunately, public health is always a pendulum. If you have a pandemic, the funding increases, and then when you don't, that money gets siphoned away to other places, and then it comes back again. And I hope that we've learned the lessons that we have to permanently rebuild our public health system. We have to have an ongoing national coordinated pandemic office, whatever you want to call it, because we do know that this is going to happen again sometime. And but until we rebuild our public health infrastructure, I'm not sure much of the rest of it's going to matter.
And Susan, I think that what we have to recognize is this doesn't occur in other countries. I mean, in other countries, when the government or the CDC of Germany or whatever says, here's what you can do, then that's what people make their own decisions. But you don't have different cities saying, no, I don't agree with that. I mean, to your point about the federal system, you look at what happened since, Dr. Walensky did the mask guidance, and you have, folks, Governor Cuomo saying, well, I'm going to have my people look at it, and here we have a situation where Pennsylvania has adopted that, but Philadelphia has not. So literally, like, I don't know which Trader Joe's I can go into without a mask, and which, if I go in Allentown, I can go without a mask. If I go, I mean, that just doesn't make any sense. And I honestly think, Ed, that actually contributes to vaccine hesitancy, because when you think the people that are telling you to do something are clueless, and you have something that hasn't been officially approved yet, so it's an emergency use authorization, it doesn't give you great confidence. And even the thing that happened with the J&J vaccine, everybody knew that they were going to, look at it for 7 days and then put it back, because there were literally less blood clots that happens than when I give a 45-year-old a birth control pill. But the fact that they did that probably caused more people to not get the vaccine by just saying, oh, we're going to look like so I think some of this is, come on, let's get together in something like this and figure out a way for the next pandemic, that if we're going to trust the CDC, then let's make sure the CDC isn't politicized, and let's trust the CDC. And let's not leave it to every single, city public health official to come up with their own theory, et cetera, because that really cost a lot of lives.
Mm-hmm.
Yeah, I'd summarize what you just said, that people will forget what you said and did, but not how you made them feel. If you've confused people, they stay confused. So let's try to untangle that confusion. And Dr. Bailey, you said something that struck my ear. You described this pendulum where we go from extreme to extreme and can't find the center ground. And Dr. Klasko in the past has talked about the idea of a 9/11 commission on healthcare. It strikes me that the AMA and futurists like Dr. Klasko would be an ideal place to start. to pull together a group that will look dispassionately, but also in a nonpartisan way at what has happened to get those main takeaway lessons, because I think a lot of people are concerned politics is going to keep the takeaways from ever seeing the light of day. What are your thoughts, Dr. Bailey?
Well, I think it's intriguing. The way AMA makes policy, I think is a good example of how, granted, they're all doctors and medical students, but bringing people from all specialties, all states, all ages, all types of practice to sit down for, 5 days, twice a year and hammer out health policy in a very democratic way. So the AMA has some incredible policy on what we think needs to happen with the health system. But we do need to get everybody at the table. There's no question about that. And, there are a lot of great ideas out there. There's a lot of money out there. There's a lot of money that's being wasted out there. And, but I worry that we're going to end up in such a chaotic situation that a government takeover of everything seems like the only option. And I just don't think that would be good for our country.
Dr. Klasko, who would you make part of that everybody that Dr. Bailey just noted? Everybody belongs at the table. Give us an idea of the kind of people who ought to be at the table.
Yeah, I had written a book in 2016 called "We Can Fix Healthcare: The Future Is Now," and it posited that when President Obama left office, he brought that kind of group together. I'll talk a little about the group he brought together. But there was a science fiction event, and there was a sort of a smoke. And what happened when you got out of that was all you could do was blame yourself. So the first thing I'd start with a rule is that anything you're going to talk about is what you can do. So I would bring in, pharma leaders. I would bring in provider leaders. I would bring in patient advocates. I would bring in VCs and digital health leaders. I would bring in insurance leaders, payer leaders. I would bring in, some folks from health policy, folks like Mark McClellan and others. And I would bring in some true disruptors, folks that really think we need a very, very different system. And then I would bring in some economists to look at how we could pay for it. But I would start off with, if you're bringing in Alex Skorsky from J&J, you can't talk about what everybody else has to do. What can pharma really do to decrease costs? The best way to look at it, Ed, is and it's actually pretty simple. One of my mentors was a guy named Bill Kissick from Wharton when I went there. And he wrote a book literally 40 years ago, and you'll appreciate this, Susan, called Medicine's Dilemmas: Infinite Needs, Finite Resources. Sound familiar? And he was the first person to talk about that iron triangle of access, quality, and cost. And he said, look, if you remember your isosceles triangle, if you increase one, you got to decrease another. He said, if anybody ever tells you they're going to increase access, increase quality, and decrease cost, and it's not going to be disruptive and painful to somebody, they're not telling the truth. So if you think about health policy in the last 12 years, President Obama, after the ACA, said, the ACA will increase access, increase quality, and decrease cost, and it won't be painful. That's a quote. So that can't be true. President Trump said, mine will be fantastic, terrific, unbelievable, and really huge, and it was none of the four. So the simple fact is, we're going to have to disrupt somebody, right? And all you have to do is look at the fact, when the ACA said, we're going to give more people access, but move $1.25 of healthcare to $1, in any other market, you would have sold every one of your middleman stocks. You would have sold United, Cigna. You would have sold some supply chain stocks. You would have sold Johnson & Johnson. Well, that would have been a really big mistake, because other than Apple, the most appreciated stocks were healthcare supply and healthcare middlemen. So just think about how can that explode and actually have a more efficient system. So we're going to have to disrupt somebody. By the way, folks like me are going to have to be disrupted, because my book, Moving from Sick Care to Health Assurance, it's hard to get somebody to pay to do something when their salary depends upon them not doing it. Most specialists that's how they're incentivized in RVUs. Insurers need to look at the 17 cents on the dollar to make sure that the people that pay for the care get the care and provide the care don't talk to each other. That's a great business model if you can get it, but that's not going to last forever. Pharma can't keep doing commercials, on Morning Joe and Fox and Friends. If you have stage 4 lung cancer, get this drug, to try to convince people like Dr. Bailey and my pulmonologist to use that $400,000 drug. Those are all obvious things that would have to change if you're going to have an efficient system.
So Dr. Bailey, we can't have a candy that's going to clean, straighten our teeth, taste great, help us lose weight. That's not going to work. And we certainly can't be vulnerable in terms of supply chain the way we were during pandemic. Could you talk a little bit about what you observed nationwide in terms of our vulnerability, or not just PPE, but also medicines, and how the Chinese have us in a very difficult position as a result?
I think that was one of the most painful lessons that we learned in COVID, was how a just-in-time, supply system just totally disintegrates in a pandemic. And and Dr. Klasko, I admire you for keeping up your PPE standards at your institution, because I'm ashamed to say that many did not. And people were being forced to reuse PPE, and many people got sick, and some people died because they didn't have adequate protection. So here I am, an allergist immunologist in private practice. I hadn't worn a face mask since I was a resident. And so 10 years ago, when the H1N1 epidemic began, my best friend, who's a pediatric ER doc, said, you have to have a pandemic preparedness plan. And I'm like, okay, what's that? And she goes, well, get some masks. So I had one box of 10 N95 masks that had been sitting on a shelf for the last 10 years. That was all the PPE that we had, aside from gloves. And, we used those, of course. But, and those 10 masks had to last the 10 people in this office until we were able to scrounge up some more, because my supply chain didn't include masks. There are lots of syringes and little bottles for allergen extract and blood tests and things like that, but not masks. And so I think every hospital, some states have passed laws about how many days of PPE you have to have, 60, 90 days. I'm not sure that's the greatest idea. FEMA thought that we were doing okay with masks because some of the big hospital systems had masks, but the little guys like me were not able to compete in price or quantity. Sure, I might be able to find some N95 masks for $5 a pop, but I certainly didn't have the capital to order 100,000 of them at a time. So I think we've learned big lessons about supply chain, what we have to have on hand, that our manufacturing capability cannot be completely dissociated from our shores. We have to have more domestic production. We've got to incentivize domestic production. And everybody will have a new PPE and supply chain paradigm going forward. I just hope that, just like that pendulum I discussed, that doesn't erode as time goes on.
Steve, Dr. Bailey just mentioned masks, and I'd ask you to get us started on this question. We forced children, very young children, into masks and closed schools. Now, that whether you kept the school open or closed is a very complex issue because of daycare and multi-generational living and all of that. But based upon what we know now, should we have had very young children in masks, and should we have closed schools?
Yeah, boy, that's a great question, Ed. So, what I tell everybody, I do a radio show every Sunday, and what I tell everybody is of the listeners is, anybody that gives you an answer to a question like that and doesn't start out with "I don't know," but you shouldn't listen to, because we don't have all some of that stuff will get answered in the future. So I'm going to start out with "I don't know, but I think as Dr. Bailey and you have said, we had a once in a lifetime, at least my lifetime, crisis in this country. And everything got politicized. And I think that even our children got politicized. It was, teachers unions making decisions, sometimes not based on science, but, what they felt that they wanted to do. There was never any really good data that young children could pass it on, but we didn't know. So it certainly made sense to try to protect them at the beginning. I think, now, especially with vaccines, it's just ridiculous to not have kids in school. I think that's pretty clear. But so much of everything we did became divisive. This is the first crisis in my lifetime, Ed and Susan, that we become more divisive, right? I mean, I wasn't around during World War II, but the country came together. Certainly we came together after 9/11. This, for some reason, we grew further apart. I mean, think about, and Susan, you're in Texas, right?
Yeah.
You're the Neanderthal thinking state. The fact is, you guys did really well.
We did.
At the point that you made that decision, there was good science to support it. But the fact that there was just such anger that your governor did that, and the statistics have been pretty good in Texas, and so at the end of the day, we just decided to turn this into a cable news and Twitter fight instead of protecting each other. So if there's one thing I hope we learn, is that, let's go to our corners when something like this happens and actually work together. And by the way, if you're a public official, please be consistent and don't be a hypocrite. Don't tell people not to travel, to Florida and then travel to Florida. Those are the kind of things that I think really get people upset and get people to not follow rules because they don't believe that anybody really understands what's going on.
So, Dr. Bailey, Steve just brought up something very interesting. You have a national role as head of the AMA, and this is a vast continental nation. Regions are different from one another in some core ways. And Texas had its own approach to things, as it typically does, and it did rather well. How, in your role, do you find best practices and encourage people to pursue them and not fall into that political trap that Steve just talked about?
Well, I think you've just got to stick to the science and look at the data, analyze the data. Part of good science is looking at the data that you have, making a conclusion based on that data. And if the data changes, your conclusions may have to change. And so that's what happened with wearing masks early on. A lot of people thought that they were lied to or intentionally misled. The fact of the matter is that the data changed and we realized that masking was very important. And so sticking to the science, just, always going back to the basics, wear your mask, wash your hands, avoid crowded, indoor gatherings, and just turning that into a mantra and just saying that over and over and over again, whether it's mandated or not, whether your political leaders are doing that or not, it's the right thing to do. And, I tried to get something going that just never had legs at all. I called it the golden rule of masking: wear a mask for others as you would have them wear a mask for you. That didn't catch on at all. But I think the concept is still a good one. But, and Texas is an interesting case. Gosh, we've still got so much to learn about this pandemic and why things have worked out the way they have. One interesting feature in Texas is that we as much as we rebelled against shutting businesses down, we had a forced shutdown of a week when we had the ice storm in February. And we were probably at our peak numbers, maybe just starting to come down a little bit on hospitalizations and deaths. And then all of a sudden, everybody is truly isolated for a week. And personally, I believe that we broke the transmission chain at that point in time, and then just got lucky as vaccines came on board that we had enough ingredients in the mix that we were able to reopen without having increases in case numbers and hospitalizations and death. But that's my own little theory.
Steve, do you have anything you wanted to add now, or can I move on to another related topic?
No, I think you put it well. I think, look, at the end of the day, there will be PhDs written and done on 1 week of this pandemic. And I think, I think we will all be able to look. And the one thing that is a constant, and I want to make this really clear because we just got done with Nurses Week. The one thing that is a constant is that nurses and frontline healthcare workers really, really were and are heroes. And when we talk about, when we talk about the pandemic didn't teach us anything we didn't already know, hey, we knew that. But think about this, we have 35,000 employees, many of them are frontline workers, but, nurses literally had to go to a front line of a war at work and then go home to a different front line of war. In many cases, we have nurses that literally had to see their children through screen doors, for part of the surge, because they were so afraid of infecting them. So they didn't want to be next to them. And they would come to work every day. We had a nurse that got COVID, and the next day she decided to go to work doing telehealth at home. So, there are certain things that are constants. And when we talk about all the things that didn't work, boy, should we be proud of those folks?
Let me, there is a question that came up about the Office of Pandemic Preparedness. I want to hold that in abeyance just for a moment, because I want to build on this question of getting the science right on determining whether to wear a mask. Dr. Bailey, you're an immunologist. Dr. Klasko, you are an OBGYN. I hear people say, don't get the mRNA vaccine. It's not safe. You're changing your DNA. You don't know about your unborn child. You don't know about your ability to have a child. J&J was rushed through too quickly. What is it that each of you would say to someone who said, nope, not doing it, too quick, too unproven, too scary? Dr. Bailey, I'll start with you.
Thanks. As far as the mRNA vaccines go, when my patients or friends, family ask me that question, I tell them that we have been working on coronavirus vaccines for over 10 years. Remember SARS, remember MERS? Well, we started working on vaccines for those diseases. Fortunately, we didn't need them, but the basic tools were there to create. We knew about coronaviruses. And then when this mRNA technology came along, I think it's important to have a little mini cell biology class to understand this, because your DNA, your chromosomes, what make you you, are inside the nucleus of the cell. They're very carefully protected. mRNA doesn't go there. mRNA is kind of the little template that floats along and goes to a different part of the cell where proteins are made. mRNA doesn't get in the cell. It's not DNA. It can interact with it, but it's not DNA. It's very fragile, falls apart really quickly. And the genius of the mRNA vaccines is that they were able to encapsulate the mRNA just long enough in these lipid particles so that it didn't dissolve immediately. And I think that it has turned out to be, I think, a genius move, because the vaccines are incredibly safe. Hundreds of millions of mRNA vaccines have been given around the world now, and we're just not seeing weird side effects falling out. we've got almost 8 months of data. Some people say that's not long enough, but I don't know, hundreds of millions of people are hard to argue with. We've never had a vaccine that caused late side effects after about 6 weeks. So the Operation Warp Speed took the financial risk out of the picture. Typically, when vaccines are made, at every step of the way, the vaccine manufacturer is going to say, okay, wait a minute, let's stop. Let's take a look at this data. Can we afford to move on? Is this worth the risk? They didn't have to have any of those worries. It was just full speed ahead from the very beginning. And thank the good Lord, the vaccines worked as well as they did.
Dr. Klasko, how would you persuade the unpersuadable?
I would say if you care about yourself and the people around you, get a darn vaccine. I mean, at the end of the day, even if you didn't want to be the first in line, because it is an emergency use authorization, at least probably for the next couple of weeks, and you could legitimately have said, well, there were X amount of folks and, 6 months worth of data. There's now, as Dr. Bailey said, literally millions and millions and millions and millions of people that have gotten this vaccine, and they're fine. And, and there's also hundreds of thousands of people that have died or have significant side effects from getting COVID. So, look, this is going to sound harsh, but, a lot of people do a lot of stupid things, right? People don't wear their seatbelt because they don't believe in that. People don't use condoms because they don't believe in that. Not getting a vaccine is just really stupid, unless you have a real reason to do it, or unless, you have a religious reason to do it, or unless, you've had some history. Like, I certainly respect our African-American colleagues who have had to go through Tuskegee and some of those things that basically look and say, well, how do I know if this is something you're doing for me or to me? There's a lot of trauma there. But if you're not one of those folks and you just say, I don't trust drug companies, whatever, then I just think you're not doing the best thing for you or your family. If you care about your partner, wife, husband, brother, sister, mother, father, son, daughter, you will get vaccinated.
Dr. Bailey, there's a question about the Office of Pandemic Preparedness. And I know from my own reading that the Bush administration, Bush 43, was very concerned about pandemics, started work, left that to the Obama administration. And then the question asks, did that atrophy leading into Trump, was it eliminated? Does it exist today? What do you know about that office that you can share?
Is this the Pandemic Preparedness Office?
Yes. So
my understanding is that, during the Obama administration, the funding lapsed. This was the swinging of the pendulum that I discussed. And then the Trump administration, decided not to continue it. And I think we need to look at, does it need to be in the executive branch? Where does, this pandemic preparedness need to be? And so I think that we need to talk to each other and to our legislators about making that a priority, whatever shape it's in, whatever it's named, to make sure that we've always got the nation's public health authorities giving real-time intelligence on what's going on out there, and so that we can stay prepared.
Steve, anything on that topic?
Yeah, look, it's just so easy to blame everybody. It's easy to say, Trump did this or Obama did this. The fact is we were unprepared. I mean, there's a great parable. It's in a lot of different religions about, there's this very pious individual and there's a flood and, the folks are coming with the boat to rescue him. I don't need to, God will rescue me because, I've done everything right. I've been I've been very pious, and then it's up to here, and another boat comes, and then finally the helicopter comes and says, "Nope, God will take care of me." And he gets up to heaven and says, "Hey, God, I've done everything right. St. Peter, I've done everything right. Hey, what do you want me to do? I sent 2 boats and a helicopter." And I think there's a little bit of that. We had all these, whoever you think did them, we had all these, Ebola, H1N1, SARS, okay? And everyone, there was one thing missing. Ebola wasn't, respiratory as much, but it was lethal. H1N1 wasn't lethal, but it was respiratory. Now, so we knew, and Bill Gates in the TED Talk had talked about in 2015, we're going to have a big one. So everybody gets to get blamed. Everybody gets to get blamed. The Obama administration, the Trump administration, governors. Again, not that we did everything, but one of the things that I'm really proud of is that we had our own pandemic preparedness thing out of Ebola that we kept going. So we had 60 days of PPE that were just stored that we hadn't used, so that we literally got a head start on some of these things that the average in our area was probably 8 or 9 days of PPE. So look, I think we can't have one country supply 92% of something that can kill us, especially since it's a country that doesn't always love us. We have to be ready for something like this, just like we're ready for a terrorist attack, or just like we're ready for a nuclear missile. This was literally the equivalent of having a nuclear missile get through our defense systems. It got through our public health defense systems. It got through our supply chain defense systems. So look, I don't want to blame President Trump. I don't want to blame President Obama. I don't want to blame 50 governors, because there's things we could have done. We could have pounded a table after Ebola and said, hey, we got to do something. We could have been lobbying, the federal government to do something about supply chain. Most of us were lobbying the federal government to give us more money for what we do, as opposed to those kind of things. So, I think we should learn from it.
Dr. Bailey, question about what's going to happen as more people get vaccinated. Does Ebola, or not Ebola, I'm sorry, does COVID just kind of wither away? Is it going to be an irritant that'll be around a while and you'll need the occasional booster shot? What happens as more people get vaccinated around the world, or conversely, if they don't get vaccinated? As an immunologist, what do you say?
As an immunologist, I think COVID is here to stay. I think it's going to reach low levels in the population that it's kind of a steady state. It just kind of stays there. But I think that the variants are what I think worry all of us. Viruses mutate. That's what they do. They make so many copies of themselves. They make mistakes now and then. Most of those mistakes are what we call nonsense mutations and don't result in anything bad. But every once in a while, a mutation will come along that makes it attach to ourselves more strongly, or be more communicable. And so that's why we need to get so many people vaccinated so quickly, so that there's just not enough COVID running around to mutate. Just improves your odds against getting a bad mutation. And I think it's going to be incredibly important that we are good vaccine, stewards for the rest of the world. Most other countries are very far behind where we are, and and there are other countries that are making vaccines that aren't available in the United States. And so we've got to count on the World Health Organization and vaccine manufacturers. I just heard the president say that we'll be giving a couple of 100 million doses of vaccines away, which I think is fantastic, because we ordered enough to vaccinate the whole population many times over. So we definitely will have some to spare.
Steve, someone pointed out we've used the term follow the science a couple times. And they say it's fine and good to talk about the science of COVID, but in its practical applications, how we respond to COVID can't just be guided by the science of COVID. There's the science of economics. There's the science of social interaction. There are all of these other imperatives that have to be weighed. So as a doctor who always does that very serious calculus, what's your prescription for how we look at everything that we learn and know and then put it into practice, recognizing its impact on the economy and people's lives.
Yeah. So look, the problem becomes, I might get in trouble for this, but the folks that are running public health departments were never meant to be economic or city managers. I mean, that's not why they got the job. My oldest daughter is a PhD in public health at Brown. I love her to death, but she shouldn't be running anything, because her whole thing is literally, how do I make sure that not one person, in her case, it's HIV is where her research has been, gets HIV. And it doesn't matter what it costs, and it doesn't matter, that's just not, that's not how a healthcare system can run. So, we have seen the classic learning lab. I mean, this is like one of those things, if you had rats in different things, and if there is a supreme being looking at it, they could just look at Florida and New York and California and Texas as 4 different rats, in this case humans, in different labs, right? Oh, Florida, everybody's going to get COVID. That Ron DeSantis is crazy. Well, it turns out that their numbers are very similar to, New York and California. California lockdown, New York, sort of in between, Texas, more like Florida, but at the beginning, was a little more conservative. The simple fact is, we still don't know anything about did lockdowns work. Most people think lockdowns did not work. Most people think that masks certainly worked. And if we had that science at the beginning, when we said don't use masks, if we had stopped air travel earlier, remember President Trump stopped air travel, that was, how dare you do that? And first Dr. Fauci said don't wear a mask, but there were certain things that mattered. And then frankly, we had people that shouldn't be looking at the grand scheme of things making decisions like lockdowns. And so, I think that what I'd like to see, and I think one of the things that some cities did, some cities didn't do as well, is they didn't depend on the folks that really are running things, right? In Philadelphia, we're blessed with 5 great academic medical centers. And as much as we might compete in normal times, we had radical collaboration. Penn, Jefferson, Temple, Mainline Health, we got together every week. So why the heck not, when it came to vaccine distribution, go to us? Like, we sort of know what we're doing in this thing, and not go to some 26-year-olds that said, hey, I think we can do it. I mean, so I think some of this is come on, let's plan for the next one and say, you know what, with the next one, we're going to literally get the health systems together. We're going to get the AMA and the AAMC, together with our policymakers, because they're probably going to be smarter than them, and not try to pretend that, some person that got brought in as a health minister for a state or a city who really isn't prepared for making literally those kind of decisions can really run what was in some cases the most important economic and health decisions that we've had in our lifetime.
So Dr. Bailey, Steve is hinting at an observation long made that the federal system allows for experimentation. And also, when you finally get the right answer, it has the advantages of scale that allows you to implement lessons learned in a very cost-efficient way. With that in mind, are there other countries who have had greater success, whose system is much different from ours? I'm thinking of Great Britain, which is very much a centrally run country where localities have very little to say. It's the national government that drives things. How do we stack up against someone like Great Britain or Italy, where they didn't do so well?
It's really interesting. One of the wonderful opportunities I have as president of the AMA is to work with presidents of other national medical associations through the World Medical Association. And we've had several conference calls, during the pandemic. And, it's very interesting. Not every country that has a national health system did real well. because the PPE situation and the economic situation, and we've discussed how many sectors were involved in this pandemic. It's not just the health system. And I think the countries that have done the best, countries like Australia, New Zealand, Japan to some extent, that had total control of their borders, their islands, and were able to have strict enforcement of testing, of contact tracing, very, very early on, and were able to keep cases down to a minimum. Korea comes to mind as well. And so I think those countries have done the best, but they also, many of them have very different cultures in terms of respect for authority, trusting what someone in a governmental position says to you and following instructions. And plus, many of the Eastern countries had experience with SARS and MERS, and mask wearing was much more normalized in those cultures than it has been with ours. But Germany, France, the Netherlands, Brazil, it's just all over the place. Every country really that borders with other countries has had its problems.
I think the two most important factors were culture, as you said, and connectivity. So countries like Singapore that have had literally national connectivity things that were able to, get telehealth out to everybody and stuff, didn't have those same kind of disparities. And as you said, Dr. Bailey, cultures where people are just used to, Israel's a good example because of all the fighting and wars. When the government says to do something, they do it. When they say we need to contact trace and know every place you're going and who you've been with, that's just what happens. Italy is more like us, hey, the government's stupid. They told me to do it. I'm going to still kiss people on the cheek because, that's what we do, and in our country, there was a lot of, during the Trump administration, anything Trump says, I'm not going to do. We had governors say that. And now, Biden administration, we have other people say, well, anything Biden says, I'm not going to do. So, that's a real weakness in our country, I believe.
Well, we live in a vast continental nation of many different people, many different mores, shibboleths. I think you have to be careful not to be too harsh on ourselves, while at the same time recognizing that our pencils have erasers.
No, and it's what makes us great, Ed. I mean, I think I don't want to get misinterpreted. I mean, that independence, that autonomous thinking is why we lead the world in creativity. Right. I mean, if you just follow blindly, you don't invent things like we invent on a daily basis, so, I think it's wonderful that we're like that. The only time it's not wonderful when there's a pandemic and we need people to sort of follow some rules.
People follow the instructions. Yeah.
You've just pointed to something. I'm going to start with you, Steve, and then go to Dr. Bailey. One of our listeners points out, we appear to have done a spectacular job in quickly determining the best method for treating COVID. So we went from that initial, oh my God, we need ventilators, to good God Almighty, don't put them on ventilators.
The bleach.
Here's that cocktail of drugs if we get it to you quickly. Tell us quickly about the kind of treatments that we have today as opposed to when all of this started.
Oh, look, I mean, we were groping in the dark for so long, right? I mean, we had the hydroxychloroquine thing, we had the bleach thing. I mean, it was every quackery that imaginable people would try. And there were some things that might have worked, but I think the combination of things like remdesivir and some of the antibody type things and, steroids, literally we started to, we do what we do best in American healthcare. The academic medical centers and the private docs, all work together. And we had clinical trial. We were part of a clinical trial of cocktails. We were part of a clinical trial of people who had COVID, getting their antibodies and giving them. That's had mixed results. So and the great thing about American healthcare is we publish everything. So in record time, we knew what worked. And then, we were able to come up with a 3-drug cocktail that pretty much kept people that get COVID from getting a lot worse in many, many cases.
Dr. Bailey, you run the most respected medical establishment in this country. What are your thoughts on what Steve just talked about?
I think that the progress has been absolutely breathtaking. We learned so early on that just flipping patients over on their stomachs made it much easier to keep them well oxygenated. I wish I knew who thought of that, but it's
Probably a
really
nurse.
very clever.
Probably a nurse.
Yeah, a nurse, I'm sure. We learned that you wait to give steroids until someone's oxygen levels start to fall, and then it's very effective. If you give it too early, not so good. If you give it too late, well, that's not so good either. But we've also learned that there's a lot we can't do, and we've just got to do everything we can to keep the patient alive until their immune system does the work for them. And unfortunately with COVID, that's in many patients part of the problem. The immune system goes haywire, the clotting system goes haywire. COVID is a monster virus that we've never seen the likes of what it can do. But I'm so proud of our medical science and learning what we've learned in such an incredibly short period of time.
Well, Dr. Bailey, Dr. Klasko, if I fell ill, or more importantly, one of my loved ones fell ill, there is no other country in the world where I would want them diagnosed and treated than this one. And we are so very fortunate that you both took the time to speak with us. The best of luck to you both as you continue to figure out the best way to deliver the greatest care to the largest number of people. And if you're open to a suggestion, you two need to get together. You need to start that 9/11 commission so that you bring the right people together, find out everything that we can to be ready for the next time. And again,
it's a deal. Dinner at 1862, Susan.
All right.
Okay.
Dr. Susan Bailey, Dr. Steve Klasko, thank you very much. I'll turn the microphone back to Mr. Miko, and ladies and gentlemen, thank you for watching.
Thank you.
Thank you.
Thank you so much for once again hosting a great program. Dr. Klasko, Dr. Bailey, we really will want to see you back here when we can have a meal together. Steve, it might be sooner than later since you're a couple blocks away, but Dr. Bailey, please, we look forward to seeing you in Philadelphia very, very soon. Thank you again for a very enlightening and enjoyable program. We are in better shape now than we were on May 6, 2020, no doubt about it. And in large part, thanks to dedicated professionals like you two. So thank you so much for taking time to be with us. And so that's our program, our public affairs program, for tonight. We have some wonderful programs coming up soon, and soon enough, we'll be doing them in person. But the next one will be on another public affairs program, May 17th. I'm sorry, forgive me. That's today, isn't it? Our next program, May 26th, another vaccination program. It's a Civil War Roundtable. Vaccination, pure and spurious, the Confederate vaccination crisis of the Civil War. And that's with our very good friend from the Mutter Museum, Mr. Robert Hicks. And then we have another public affairs program on June 9th, which will be on the future of public schools. So we look forward to seeing you at those two programs. Again, thank you for being with us. We'll see you again on one of our programs very, very soon. Thank you.